Hello, let's get to know about the major difference between the two most confusing bone lesions. One is giant cell tumor, the other is aneurysmal bone cyst. Let's see theoretically before we go into the X-ray features. So, the giant cell tumor occurs after the skeletal maturity. It is also known as osteoclastoma, and it's a locally aggressive and it occurs at the epiphyseal metaphyseal junction. It occurs more in females than in males, and please note on the age group that is 20 to 40 years. This can be a key point in the MCQs. And it most commonly occurs in the knee at the lower end of femur. The most common tumor at the distal end of radius is GCT. And the treatment for GCT is extended curettage, liquid nitrogen, and bone cement. On the other hand, aneurysmal bone cyst is multiloculated. It is expansile or ballooning cyst. These are the key points you should look for in the MCQs. And it's a metaphyseal lesion. It occurs in the age group of 10 to 20 years, that is that of the older children. And it occurs around the knee, and most commonly this cyst contains blood, and the treatment is same as giant cell tumor. So now let's look at the X-ray features. So in the giant cell tumor, clinically you can palpate the eggshell crackling, and on the X-ray you can see the sobable appearance as you can see here. And this is a purely epiphyseal metaphyseal lesion. On the other hand, aneurysmal bone cyst is purely a metaphyseal lesion, and you can see the ballooning expansile look. And the key point to note is that here you can see the growth plate open while it's closed in GCT. So here and again another X-ray where you should find which is GCT, which is aneurysmal bone cyst. Yes, you're right. This is GCT and this is aneurysmal bone cyst. Here you can see the growth plate closed, and here it is open, and this also is an expansile lesion. And finally, this is the histopathology of the giant cell tumor. This can also be sometimes given where you can see the giant cells clearly.